The topic of our today's lecture is thermoregulation and care of the patient with fever. Also, we'll stop on the simple physiotherapy procedures. Thermoregulation is the ability of an organism to keep its body temperature. Body temperature is controlled by the thermoregulatory center in the hypothalamus, which control our body temperature on the definite level. But inside the body and on the surface of the body, our temperature slightly deviates. More high fever localizes into the inner organs, which are rich with blood circulation. There are first of all brain, central nervous system, organs of the chest, heart and lung, organs of abdominal cavity and small pelvis. On the superficial surface, temperature slightly diminished and it's low on the terminal part of upper and lower extremities. Our temperature is held on definite level depending on the sign order, and first of all we are talking about physical thermoregulation, which control removing heat from the body, because definite body temperature is held due to correlation between heat production and heat loss. Heat production process is called chemical thermoregulation. Both these processes tightly correlated and connected with vascular thermoregulation due to periodic narrowing or expanding of the blood vessels. And you understand, when the vessels narrow it, heat loss diminish. When the vessels dilated, heat loss intensify, and our organism regulate itself body temperature, keep some heat inside the body or remove it to hold definite body temperature. To know about body temperature, we can measure it with different order. Measuring body temperature is called thermometry, which firstly was described by Daniel Gabriel Fahrenheit, and in some countries will measure body temperature in Fahrenheit, or in some countries in Celsius degree. Usually we'll measure body temperature in morning when the patient gets up on empty stomach and before any physical activity. Usually it is between 7 to 8 hours a.m. In the evening, we'll measure body temperature between 5-6 hours p.m. usually before last food intake, because you must understand any physical activity, taking of food, activates blood circulation, and as a result body temperature may be increased and we can have false result. But we must remember, in some situation fever may be controlled oftenly, and sometimes we can control body temperature 3-4 times per day. Body temperature may be measured with different types of thermometers, and first of all we distinguish mercury thermometry, which widely used at home and in clinical practice also. Depending the using, we distinguish auxiliary thermometer, which is used to measuring auxiliary body temperature, oral thermometer, which slightly thin, and it is used for measuring body temperature in oral cavity, and rectal thermometer, which is used for measuring body temperature in anus area. Mercury thermometer very easy for using. They can be used widely in clinic and at home. There are the advantages, and we can easily record body temperature, but they have some disadvantages. And first of all, its basic structure, mercury, because if the thermometer broken and we cannot completely remove mercury, it maybe provoke fractures, some pathological process. Uh, Indication and contraindication are characteristic for any types of mercury thermometer. No, for example, oral thermometer cannot be used for children, for the unconscious patient, for patients with some psychic disorders, because you understand, if the patient bites thermometer and it's broken into the mouth, first of all, trauma with glass and poison with mercury. Rectal thermometer are used in definite cases. Usually it is used in obstetric practice when we want to control activity of the ovaries in a woman which have some problems with pregnancy. Electronic digital thermometer widely used now in our practice. They may be institutional, which first of all used in hospital, and individual, which widely used at home and in any institutions. And chemical dot thermometer may be used in home practice because they show temperature very fast, such as electronic digital thermometer. Electronic digital thermometer usually will measure body temperature in axillary region. Chemical dot thermometer on the forehead of the patient. We put scale, and depending color of indicator, we can measure body temperature and differentiate norm from pathology. Now you meet in clinical practice, especially in our specific epidemiological situation with virus COVID-19, we can see measurement body temperature in infrared thermometer, which widely used in any shop, in theater, and any other theater with a lot of people for immediate control body temperature. Now, to talk about pathology, we must be oriented in norm. Normal body temperature varies from 36.4 to 37 in Celsius degree. Normal body temperature also slightly deviate depending side of the body where it is measured. We are talking about axillary body temperature, which has definite deviation. But if we measure body temperature in oral, rectal, or sometimes esophageal area, it may be slightly higher, because if you was attentive at the beginning of our lecture, I said vascular order regulation of body temperature. Oral cavity very rich with capillary network, and as a result temperature slightly higher. Same process into the rectal area, but when we'll measure in esophagus, it is used very rare cases, only in special medical institutions. This temperature is measured inside the body, and if you remember the picture where I showed you site with different level of body temperature, you must remember into the body temperature slightly higher and normal esophageal temperature nearly 37.5 degree. But I'll again remember in our clinical practice more often we'll use measuring body temperature in axillary region. It's more comfortable for the patient and hasn't any contraindications. How correctly to measure body temperature in axillary region? First of all, armpit area must be dry, because if it will be moist, we can have false result. Thermometer must be clean and sterile. Usually it is sold in sterile container or in special container with disinfected solution. We'll take thermometer, also dry it and put in armpit area. Patient tightly holds the hand to the body and will measure body temperature during 10 minutes in axillary region with mercury thermometer and nearest 5 minutes with electronic dot thermometer. If we'll use mercury thermometer, first of all, it must be shaped that its grade level will be nearest 35 Celsius degree. After 10 minutes, we'll remove thermometer from axillary region and record our body temperature. And you see on the scale of thermometer show it high normal level of temperature, 37. Normally, I'll remember you, it varies from 36.4 to 39.9 or 37 Celsius degree. After using, thermometer must be clean and again hold in special container with disinfected solution before next using. Temperature recorded in special temperature sheet. You see, it's divided first of all on degree. Every line is situated 0.2 degree. Then every day divided on morning and evening time. We set that optimal time of the measuring body temperature, morning and evening time. And then nurse put mark morning, evening, morning, evening. When we interconnect this mark, we'll have temperature graph. And if you see on this graph, you see time of high body temperature, then alters with its normalization. Except body temperature, in temperature sheet obligatory control blood pressure, pulse, respiratory rate sometimes is needed, intake and excreted liquid. Full information first of all needed for heavy patient which control in emergency aid department, because there are main vital indices. Body temperature which exceeds 37 Celsius degree is called as hyperthermia. Body temperature may be increased due to two physiological and pathological causes. Now let's see when physiologically, other word health patient can have high body temperature. First of all, we'll pay attention on age of patient. Senile patient, due to some disordered physiological process, physiological elderly of the organism, some hormones correlation may be slightly disturbed, and we can reveal insignificant increased body temperature. Sometimes it's doesn't accompany it with some subjective discomfort. Patients are known about it and it may be revealed in casual case. But we must be remember about possible physiological hypothermia correlated with age of patient. We must remember about exercise because during increased physical activity, blood circulation intensified, and if we measure body temperature immediately after physical exercise, its level may be slightly increased above the norm. And if you remember our lecture's beginning, we said that temperature is measured before intake food and before any physical activity. Endocrine system take part in regulation body temperature. First of all, it is action of anterior lobe of hypothalamus, but some enzymes of thyroid gland may intensify blood circulation and increase body temperature. Stress factors, severe psychic excitation also may accompany it with increased body temperature. We must remember about some drugs which because every medicine has two effects, positive and negative, and some medicines can increase body temperature about which we must remember. Environmental temperature. If you measure body temperature of the patient which a long time was under sunlight exposure, his temperature may be increased. And we must remember about daily fluctuation. Completely healthy people during day period of high functional activity of central nervous system, digestive system, cardiovascular system, have slightly high body temperature comparing with early morning and evening body temperature. Other words, the patient without activity and with high vital activity can have different body temperature about which we must remember. But when we'll record high body temperature, first of all, we must exclude pathological causes of hypothermia. And first of all, body temperature increases due to action bacterial or virus infections, any inflammatory process, bronchitis, pyelonephritis, influenza accompanied with high temperature. We must remember about specific infectious diseases which can give different level of body temperature. Some periods with increase, significantly increase, which alters with normal or sometimes subnormal body temperature. We must remember about intoxication because circulation of any foreign tissue, any foreign substances in our organism accompanied with high fever as protective response of our organism on any foreign body. After trauma, severe trauma, especially which accompanied with bleeding or trauma with accompanied inflammation, also characterized with hypothermia. Body temperature increased, we are talking about hyperthermia. Depending on the level, we distinguished any types of elevated body temperature. Temperature from 37 to 38 degree is called as subfebrile, which is characteristic for insignificant soft pathological process in our organism. From 38 to 39 Celsius degree, it is moderately high. It shows that pathological process more intensive and response of our organism is more high. From 39 to 40 Celsius degree, temperature is called as high temperature, which is characteristic for heavy infectious process, sepsis, or some specific pathological process. Over 40 degree is very high, and temperature which exceeds 39 degree needed our doctor's helpness because it may be complicated with heavy pathological process in our organism. And body temperature over 41, 42 Celsius degree is called as hyperparetic, and we afraid some severe complication because if the temperature significantly and this process is needed emergency aid, we must give the patient hypopyretic medicine to decrease before moderate level because over 42 degree temperature is dangerous for our organism because maybe destruction of protein. You know that our organism is activity of protein, and if the protein will be destroyed, maybe stop all metabolic process because all enzymes, all cells, all tissue are built first of all from protein and depend from protein activity. Depending cause of fever, we distinguish definite types of fever. Now, for example, if the body temperature elevates during short time, sometimes without any subjective disorders, we are talking about febris ephemeral. It's is characteristic for children. It may be characteristic for senile people. Sometimes it may be result on some physiological process, severe stress, for example, physical overloading, and on any other process. If the period fever durates before 15 days, we are talking about acute fever, which is characteristic for more acute infectious and therapeutic diseases. If the body temperature exceeds 45 days, we are talking about chronic fever. It's maybe characteristic for the people with long-standing chronic diseases, with some canceromatous process, with some specific infectious diseases. And if the fever periods deviate from 15 to 45 days, we are talking about subacute fever. Depending on length of fever, we distinguish acute, subacute, and chronic fever. Types of fever are depended from its origin and will determine any types of fever depending of some characteristic of temperature graph. I said you will record fever 2 times per day, morning and evening. And to determine types of fever, first of all, we'll pay attention on its level in morning and evening period. For many types of fever, morning temperature is lower than evening temperature, but maybe some situation and some types of fever when will be opposite correlation, morning temperature higher than evening. First rule, we'll compare morning and evening temperature. Then we'll pay attention on distance deviation between morning and evening temperature. And if the morning temperature every day lower than evening and deviation between morning and evening temperature doesn't exceed 1 degree, we are talking about constant fever or febris continua, which is characteristic for many inflammatory diseases, bronchitis, pneumonia, pyelonephritis, etc. Constant fever is characterized with 1 degree deviation between morning and evening temperature, morning temperature always less than evening. Next type of temperature, remittent fever or febrile remittance. If you see on this graph, you see morning temperature is lower than evening, but deviation exceed 1 degree. Sometimes it's more than 2 degree between morning and evening temperature. And temperature decreases but whenever come back to norm. You see lower level above norm, 37 degree. We are talking about remittent fever when morning temperature is less than evening, the deviation more than 1 degree, 2 or sometimes more degree, and it's whenever come back to norm. Such types of fever is characteristic for more heavy diseases, purulent diseases, diseases which accompanied with destruction, such as tuberculosis, for example. Other type, hectic fever, more heavy for the patient because you see deviation between morning and evening temperature exceed 2 degrees, sometimes 4 degrees. Morning temperature low, but periodically it's drop before norm. You must understand our organism easy response on chronic situation which change gradually, but very difficult when the situation change faster, other words any acute situation. And if the fever from norm first of all increased more than 44 degree, and then drops before norm and again rises, our organism very difficulty responses on this process, and patient will be with very heavy conditions because it's very difficult for activity of inner organs. You understand, in high fever one activity and first of all cardiovascular respiratory system, in normal condition situation change, and if deviation significant and change during short period, organism difficulty responses on this situation. Hectic fever, deviation more than 2 degrees, morning temperature less than evening, and periodically decrease before norm. Such type of fever is characteristic for more heavy pathological process, sepsis, when the infectious process spreads along whole organism. Lymphogranulomatosis is examples of severe blood diseases. Intermittent fever, also heavy for the organism because you see short time fat increase body temperature significantly increase, then drops before norm and some days varies near it the norm, then again suddenly increase and again drops during one day and again short time of normal body temperature. When the period of normal body temperature alters with short time when the body temperature significantly increased, we are talking about intermittent fever, which is characteristic for specific infectious diseases, malaria. Recurrent fever. Fever is recurrent. If you see on this graph, you can see periods of increased body temperature alters with normal period. And again, some days high fever, some days with normal fever. It's slightly different from intermittent, when the peak of increased body temperature very short during 1 day. This case we see period increased body temperature maybe some days, sometimes during a week. Then it alters with approximately half period. Recurrent fever is characteristic for specific infectious disease replacing fever. Inverse fever. First of all, characterized with opposite deviation between morning and evening temperature. All preceded grade has same characteristic. Morning temperature is less than evening, and only depending distance between morning and evening temperature or time between increased and decreased temperature, we said about definite type of fever. Inverse fever, opposite correlation, morning fever higher than evening. Each is main its characteristic. Such fever also characteristic for long-standing pathological infectious process, sepsis, tuberculosis, brucellosis. Irregular fever hasn't any specific characteristic. We cannot find any correlation between morning and evening. Temperature may be increased on 1 degree or 4 degree. One day morning temperature higher, other day evening temperature high. No any correlation. If we cannot find any order, we are talking about irregular fever, febris irregularis. Also, you see any severe long-standing pathological process, sepsis, tuberculosis, rheumatism. Undulant fever, febris undulant, is characterized with wave-like order increase and decrease temperature. Temperature gradually increase during some days, then gradually decrease, and again increase and decrease. Such fever is characteristic also for long-standing infectious brucellosis or blood disease lymphogranulomatosis. Fever may be characterized depending on time of the development. We distinguish three periods of fever. Period when the temperature increases, stadium incrementing. During this period, process of heat production exceed process of heat loss. If you remember, at the beginning of our lecture, we said about thermoregulation. It is possible when the process heat production and heat loss tightly correlated, and this process is controlled with diameter of peripheral vessels first of all. Stadium incrementing, peripheral vessels constricted, heat production increases, heat loss diminish, and all heat kept in our organism. As a result, patient feels severe discomfort. Stadium fatigue, period when the body temperature during some days, sometimes months, holds on high level. Organism prepared to this condition, patient will feel some discomfort depending on level body temperature, but some compensatory mechanism will be involved in pathological process. And stadium decrementing, period when the body temperature come back to normal. Stadium incrementing, stadium fatigium, when the temperature decreased, increased, a dependent correlation between decreased and increased level. We determined some types of fever about which we said 1 minute ago, and stadium decrementing, when the temperature come back to normal. Stadium decrementing may be differentiated on two types depending time during which body temperature come back to normal. We are talking about lysis, when the temperature decreases during some days. It's more comfortable for our organism because organism gradually change their pathological activity, and it's easy field of the patient. Stadium decrementing during some days. It's better for the organism. Crisis. Temperature drops during short time, sometimes during some hours. And you understand it's very bad for organism. We easy feel situation when the process intensifies or opposite deviation appear during some times, and badly when this process appears suddenly increase and suddenly decrease. Stadium decrementing divided on two types: lysis, more comfortable for the patient, and crisis, more dangerous for the organism. Let's talk on the care principles of the patient with fever. It will be different depending period of fever. Period elevation body temperature. We remember peripheral vessels constricted, heat production prevalented over heat loss. We measure body temperature increase, patient feels severe chills and subjective discomfort, headache, or high respiratory and cardiac rate, because physiologically every degree of the body temperature which exceeds norm accompanied with acceleration cardiac rate on 10 beats, respiratory rate on 4 movement. And during this period, depending on level of body temperature, if it's subfebrile, we not obligatory used hypopyretic medicine, because it is protective response of our organism on any pathological process. But patient feels subjective discomfort, chills and cold. We must warm him. Sometimes can put hot water bottle, can give him hot tea. And first of all, our attention on activity of respiratory and cardiovascular system, because if the responses will be not adequate fever, for example, accompanied irregular heartbeat or accompanied with a deviation blood pressure, we can decrease subfebrile body temperature with hypopyretic medicines. All will be dependent from the condition of patient. Period of high temperature, stadium fatigue. Organism prepared to new situation. Patient feels subjective discomfort because it's accompanied with increased cardiac and respiratory rate, but organism slightly ready to new situation. And you know that body temperature periodically decrease and increase. And if period when the patient feels hot during this period, because process thermoregulation change and heat production approximately correlated with heat loss. Peripheral vessels slightly expanded. We can see reddening of skin as a result intensive blood flow along the peripheral vessels. And period when the temperature increase and patient feels hot, we can put some cold procedure, for example, cold compress or ice bag, first of all on the forehead. We can clean the body with some solution with room temperature to intensify heat loss. This process helps decrease body temperature. We warm the patient with water. Water may be added with ethanol or other substances. Sometimes it may be enough, especially for the subfebrile body temperature. At period when the temperature decreases, we can give patients some food, but we must remember it must be easy assimilable, because we'll exclude overloading on body systems and organs, because if we give the patient heavy food, it's needed uh, increased activity of digestive system, and it's involved cardiovascular system. It's overloaded due to periodic increased body temperature, and a patient with fever needed light and easy assimilable food. Usually it must be liquid or semi-liquid. And period of decreasing temperature, stadium decrementi. Our care will depend from its order, crisis or lysis. If the lysis order, our care resembles care of the patient with fatigue period. Temperature gradually decrease. vital activity of the patient may be widened. He can sit in the bed, he can go over the room, especially during period normalization of body temperature, will be widened his feeding and some vital activity. More heavy, if the temperature diminish with crisis period, suddenly drops, it's accompanied with severe sweating. Sometimes we must change bed and body leaning 2-3 times per day. And during this period, we'll obligatory pay attention on the skin of the patient because sweating can provoke comeback infectious process. We remember if the period diseases or period of the stadium fastigium prolonged, organism becomes weaker because lost all his force on the immune response on any bacterial or infectious virus process. And during this period, if the temperature drops very fast, suddenly will control activity of vital organs. Central nervous system will pay attention on consciousness of patient because it may be disturbed during this period, maybe some irritative disorders such as hallucination, delirium, will pay attention on activity cardiovascular and respiratory system, will count cardiac, respiratory rate, measure blood pressure, will pay attention on activity urinary system, control diuresis, and it must be tightly correlated with intake liquid because during a period of crisis, some functional activity of vital organs may be significantly disturbed and may be some acute situation which needed our emergency aid. Opposite condition, body temperature lower than norm, lower than 36.4 Celsius degree. We are talking about hypothermia. It shows that metabolic process in our organism decreased and will pay attention if the body temperature becomes below 34 and you see red color because it is a grave condition 28 Celsius degree. Because opposite process, if you remember, I said you during hyperpyretic period will afraid process destruction of protein and as a result disordered metabolic process and death of the patient. Hypothermia, all metabolic process significantly slowed and becomes not adequate with definite vital activity. It's also dangerous for our organism. What is cause of hypothermia? First of all, it is excessive heat elimination when the process correlation between heat production and heat loss is correlated. When the process heat production significantly decrease and again not correlated with heat loss. And it is result of long exposure to cold environment. Especially will meet the patient with hypothermia during winter period, and will meet patient without definite sight of the life. Uh, they easy live on the street during warm period and difficulty during cold period. No, some acute situation, some transport problem or some acute changing of weather to which patient not ready. Hypothermia negative process for the organism, but it may be used in medicine, and sometimes some surgical manipulation may be made in the case of hypothermia, because we needed that blood flow and uh, vital activity of some organs will be depressed. Usually it is used in cardiovascular surgery manipulation, and before this manipulation will gradually decrease body temperature. We cover the patient with special blanket. We can introduce some solution which temperature gradually decrease and will gradually decrease temperature of blood, which go along our organism, and this process obligatory must be gradual. Sometimes hypothermia is used in pediatric practice to hold life of newborn, but more widely in cardiovascular surgery. Thermovision is a specific instrumental examination of the body, which is based on the measuring body temperature on the different sides of our body with special apparatus, which is widely used for screening, fast examination or big population of the peoples to reveal some pathology and decide question about next specific examination. And we see on this graph side with red color show zone with some problems. Thermovision is method examination which is based on measuring body temperature in different sides of the body, widely used for screening examination. And at last, I want to stop on some simple medical procedures which widely used in clinical practice and especially at home. We'll stop on some manipulation as a warming compress, hot water bottle, mustard plaster, and cups. I combine this manipulation because they have same characteristic. All this procedure intensified blood flow and may be named as hot procedures. Other manipulation, moist cold compress and ice bag, are named as cold procedure because due to their action, vessels, peripheral vessels and muscles constricted, blood flow diminished, and metabolic process in our organism also slightly diminished. Every manipulation has positive and negative effect. As a result, first of all, we must know indication and contraindication for this manipulation. We'll start from warm procedures. Warming compress is widely used at home. It's divided on dry and moist because if we put hot cloth, dry cloth on the body, it will be dry compress. If it will be moistened with warm water or with water which add with alcohol, it will be moist compress. Indication for this manipulation. Any local inflammatory process which needed warm manipulation. First of all, there are muscles and joints diseases and some chronic inflammatory diseases. For example, bronchitis, inflammation of the ear, inflammation of the throat, local inflammation of extremities. But this manipulation has contraindication. Warming compress contraindicated of the patient with any skin diseases. Patient with fever during period of high fever, stadium fatigum, patient with new growths, tumor, and patient with bleeding. Because we know any warm procedure intensified blood flow. You understand patient has any trauma, I will intensify blood flow and intensify bleeding. Patient with tumor will intensify blood flow, will provoke formation of metastasis. Patient with fever, heat loss diminish, I will argue this process and can provoke more high fever. Let's see order development of this manipulation. Any warming compress must be made from 4 layers. First of all, we must take piece of tissue which may be dry or moistened, which will be placed on the some sides of body. Then it's obligatory covered with wax paper or polyethylene to hold warm. After that, we can put some cotton wool, usually 3-4 centimeters of thickness, and we must hold this compress with bandage. Warm compress may be placed from 6 to 8 hours. Dry longer, moist shorter. And you must remember about main principle. Each subsequent layer must be bigger. You see, we take one size of tissue, then polyethylene 2-3 centimeters higher, cotton wool again 2-3 centimeters higher, and bandage also will be outside of cotton wool on 2-3 centimeters in every direction. If we'll use moist warm compress, I said you will moist some pieces of tissue in warm water, or we can add alcohol 40 degree because it's more longer hold warm. Then it must be slightly dry and put on the body. Now you see patient with inflammation of ear and will put moist warm cloth around the ear. Then we'll put polyethylene and you see its size exceeds size of the cotton. Then cotton wool 3-4 centimeters of thickness and bandage with which fix our compress. And it may be hot on all night. For example, nearly 8 hours. It holds warm near the inflamed area, intensify blood flow, and all pathological agents and toxic substances more faster will remove from the pathological area, but level of new active leukocytes which and active immune agent faster go to pathological area. Cold compress, opposite manipulation. The indication fever period increased body temperature. 4th hour after trauma and bleeding, because it has opposite action. Vessels constricted, but blood flow slowed and will regulate process of heat loss and heat production, will decrease blood flow, help stop bleeding, and decrease activity of inflammation. First time after trauma, cold compress. Later, we can use warm compress. For cold compress, we use cloth of the tissue which moistened in cold water, put on definite side of the body. When its temperature increase, will again moist and repeat manipulation such often as needed. Again, warm procedure, hot water bottle or heater. It is used in spastic pain, patient with peptic ulcer but without predilection to bleeding, patient with renal or hepatic colic because hot procedure dilate or relax peripheral vessels and peripheral muscles. It's widely used patient with radiculitis, inflammation of peripheral nerve ending, patient which over cold will put hot water bottle and organism gradually warm, and 4th period of fever, stadium increment. You remember, patient feels temperature increase, but patient feels cold and chills, and we must warm him. For this manipulation, we can use hot water bottle. Contraindication. Same as for any warm procedure. Skin diseases. 2nd period of fever, when more optimal cold procedure, cold compress, for example, tumor, bleeding, absco-abdominal pain. If you unknown that cause of pain is spasm of muscles or spasm of some ducts, we whenever use hot procedure, because cause of severe abdominal pain may be acute surgical situation, maybe trauma of organ, maybe the destruction, maybe peritonitis, situation when hot procedures contraindicated, and 3rd day after trauma. For this manipulation, we needed heater, which is rubber balloon with volume 1 to 3 liters. For small children, we'll take small heater. For adult, large heater. We needed water nearest 60-70 Celsius degree and towel. Let's see order of this manipulation. We'll open rubber balloon, put 70 Celsius degree water, but not completely. Level must be 2/3 of volume your heater. No, for example, if it's volume 1 liter, we'll put nearest 700 milliliters. If 3 liter, more. Then we'll tightly close opening of heater and obligatory turn it to check our clamp. Because if some damage and you immediately put heater on the patient body, maybe burning of patient, because temperature of water 70 degrees. Hot water. Then heater obligatory covered with towel, and we can put on definite sides of body. For example, patient with spastic pain in urinary bladder, cystitis, we can use heat procedures. And this manipulation may be Hold as needed before decreased temperature of water into the heater. Time not restricted. Ice bag. Opposite, cold manipulation. Cold manipulation. The indication are contraindication for hot manipulation if you was attentive. Ice bag used first hours after injuries, after bleeding, and second period of fever, stadium fatigum. For this manipulation, you needed flat rubber bag, small pieces of ice and towel. We'll open rubber bag, put inside some pieces of ice, but again not completely because volume of water will, when the ice bag will warm, higher than volume of ice pieces. Now, if we haven't ice pieces, we can put cold water. Then it's obligatory covered with towel and will place on definite size of body. Now, for example, hand after trauma. But I'll pay your attention. This manipulation, on contrary from hot water bottle, restricted in time. We can put ice bag on 20-30 minutes. Then it obligatory must be removed because we're afraid of cooling. You remember, cold procedure restrict blood, constrict blood vessels and restrict blood flow. Any long-standing overcooling complicated with some inflamed diseases. We give some break 20 minutes, and if needed, if bleeding continues or patient feels continuous pain after trauma, we can repeat this procedure, but obligatory with break after 20-30 minutes. Sometimes we can use slightly longer if needed, but ice bag not immediately placed on the body. It's fixed 4-5 centimeters above the body, and you'll understand action of cold will be slightly softer and manipulation can prolong. Mustard plaster. Specific manipulation in which we'll use some action of attempt, which will be removed after warming of specific powder, which might be placed in specific small bags or might be placed on the pieces of paper. Mustard plaster widely used in inflammation of peripheral muscles, myositis, inflammation of peripheral nerves, radiculitis, patient with respiratory system diseases, bronchitis, pneumonia. Sometimes may be used for the patient with cardiovascular problem, attacks of angina pectoris, short period of coronary pain, and headache due to increased blood pressure. Contraindication. Now, first of all, skin diseases, because we'll put a specific mustard powder which may be irritative for skin. Period of fever, because mustard plaster is warm procedure, and same tumor, bleeding, and hypersensitivity. For this manipulation, we'll take mustard plaster. I said we can put mustard on powder on the pieces of paper or inside the small specific bags from the thin paper. We needed water, which temperature must be nearest 40 degrees. I'll pay your attention. If it will be higher, a very fat removed and will not see the action. If lower, a thing cannot be free from the mustard. And towel. We'll prepare equipment. Then let's see on manipulation. Every paper with mustard powder must be moistened into the 40 Celsius degree water and then will place on the definite side of body depending of diseases. If bronchitis, we put along course of bronchus, which is intrascapular space, but pay attention, will not put on the spinal cord. We can put on the lower region in radiculitis, on the occipital region in headache due to high blood pressure, on the heart region short time in the spasm of coronary vessels. Then we'll cover patient with towel and hold master plaster on 10-15 minutes, depending sensitivity of the patient's skin. After that, mustard plaster removed, skin must be cleansed and again covered with blanket to hold warm. Usually this manipulation used during time of daily rest or before night sleep. The patient can sleep after this manipulation 1-2 hours. Last manipulation on which I want to stop today, it is cupping glasses. Same indication as for mustard plaster, but slightly different action. If mustard plaster, due to action of stimulate blood flow, cupping glass also stimulate blood flow, but due to other action, due to some rupture of peripheral vessel, and in this area will intensify passage of neutrophils, which are protective cells of our organism, which helps very fast remove toxic foreign substances from organism. Contraindication for this manipulation, same as for any warm procedure, skin disease, fever, tumor, bleeding. For this manipulation, we'll need some set of glass cups, vaseline, alcohol, forceps, cotton wool, bonnet, and blanket. Let's see order this manipulation. Cupping glass must be clean, maybe sterilized in hot water. Then we'll moist the skin of the patient with vaseline. It is needed that glass tightly pressed to the body. Then we'll bond some cotton which is fixed with pincet, bond, and I pay your attention, will very fast put bond inside the cupping glass. You'll understand our air has 20% of oxygen, which very fast bond. And when we'll put forceps with bond inside the cupping glass, we'll remove 20% of oxygen and we have short free space. And if this manipulation very fast and will immediately put the glass on the body, skin and sublime subcutaneous fat tissue immediately moves inside and cupping glass will fix on the body. But I'll pay your attention, we'll work with bone and to prevent bone in trauma of patient whenever it may be can be made over the body, only nearest the body, nearest the body. And then we very fast push the glass on the body and you see some skin moves inside. You'll understand we can put cupping glass only on area which has subcutaneous fat tissue, whenever on the scapula, only surround them. And then more fast manipulation, then more free space inside the glass, then more thick skin which moves inside. Then we'll cover the patient with blanket on 15-20 minutes. Area with the cupping glass fixed on the body, accompanied with traumatization and rupture of peripheral vessel. And then into this traumatic area will be active flow of neutral field. And if we'll put cupping glass over affected area, for example, there are patients with bronchitis, pneumonia, together with peripheral vessel, neutral fields actively go in organs vessel and process health of patient will be intensified. After 15-20 minutes, we slightly press finger nearing the edge of cupping glass and move it to the side. You see some bruise, it shows effect of our procedure. After sometimes it disappears independently, we can repeat this procedure after some days again. In our practice, we can use cupping glass message. I think you listen about this procedure. That's all information which I wanted to give you today. Thank you for your attention. I think this material helps you during preparing to practical classes. Goodbye, be healthy. We'll meet with you next week.
Спасибо. Потому что надо что-то надо загружать еще. Ну да, может, ее так позже как-то загрузить. А включить